It's Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies. We also provide tailor-made solutions for hospitals and intensive care units, whilst providing quality care for long-term ventilated adults and children with tracheostomies, medically complex patients at home, including home TPN, home IV potassium infusions, home BIPAP and CPAP, as well as home tracheostomy care for adults and children that are not ventilated, as well as IV antibiotics. We also provide services at home for port management, central line management, PICC line management, as well as Hickman's line management. We also provide services for palliative care at home. In essence, we are providing a genuine alternative for a long-term stay in intensive care and pediatric intensive care. Also, we are also providing an emergency department bypass service for the Western Sydney local area health district, where we send our critical care nurses into the home, sometimes into residential aged care facilities, to keep our clients at home and avoid ED even. Now, today, I want to focus actually on some testimonials, because I'm very busy here. As you can see in my videos, I'm very busy answering questions for families who have loved ones that need intensive care at home. But today I also want to, focus on some testimonials that we're getting with all the work we are doing. And I will focus on some of them a little bit more in the next few weeks, because they're also coming in. So big shout out here to our team. And I just want to read out one testimony today. Saying thank you so much, Intensive Care at Home, to you, Patrik, and all and you and your staff have done to help out our family. It was the most mentally relaxing respite we have had in the whole of our son's years. Knowing that he was at home, the consistency of staff, Mel and Steve in particular, the competency, the dedication, the knowledge, and reliability made the time away so much more relaxing, and our confidence in who was there left us feeling comfortable to go on a holiday. Also, the constant updates and messages were an added bonus to what we have had in the past. We are so very blessed. And this is from one of our clients who wants to stay anonymous, but they are one of our long-standing clients where we provide 24-hour NDIS-funded nursing care, and the client is actually on a BiPAP ventilator with a complex medical condition. So that's a testimonial for today. I have others to come over the next few weeks. Like I said, we are busy delivering the service, and we very rarely, also celebrate, our successes, and we very rarely celebrate, our staff that are out there on the road, our ICU nurses that are on the road, improving the quality of life for our clients and their families, but also improving the hospital system by keeping our clients out of the hospital system, by keeping our clients out of intensive care, right? So we're taking pressure off the healthcare system in the hospital. We're also reducing the cost of an ICU bed by around 50%, right? We can never forget looking at the bigger picture here, what we are doing and how much money we are saving the healthcare and hospital system, and also keeping ICU beds empty so that the people who need acute critical care can have it, So with intensive care at home, currently we are operating all around Australia and in all major capital cities, as well as in regional and rural areas. We are an NDIS approved service provider. We are a TAC approved service provider in Victoria, iCare in New South Wales, NIISQ in Queensland. We are also a DVA, Department Veteran Affairs approved service provider. We have also received funding through public hospitals, departments of health, as well as through private health funds. So please reach out to us if you need help. And if you are a critical care nurse and you're looking for a career change, we want to hear from you. If you have worked for a minimum of 2 years in critical care, ICU or ED, or pediatric ICU, and you ideally have completed a postgraduate critical care qualification, we are currently having jobs in Sydney, Melbourne, Brisbane, and in Albury, Wodonga on the New South Wales Victorian border. in Bendigo, in country Victoria, as well as in Warragul, in country Victoria. We want to hear from you. Please also know that if you are interested in working for us, that we are not an agency. We are looking for really competent staff that want to work with our clients, that want to build relationships with our clients. Please only reach out to us if you are genuinely interested in working for us. We are, once again, we are not an agency. We are a service provider that has a tailor-made solution for our clients, and that includes regular staff, just like you've heard from the testimonial. Please only work with us if you are genuinely interested building relationships with our clients, if you want to become a regular team member, because that's what our clients want. They don't want to have people coming and going. They want staff that can work regularly with their loved ones, and we want the same. We want you to have regular work with us for stability. It brings you stability, it brings us stability, it brings our clients stability, and it's a win-win situation. So if that's for you, we absolutely would love to hear from you, and you can reach out to us by either calling us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com. Also, if you are an intensive care specialist, we are currently expanding our medical team as well. And if you are an intensive care specialist and you have bed blocks in your ICU, which I know you have, then I encourage you to reach out to us as well. We can help you eliminate your bed blocks in ICU and ED by taking your patients home or keeping them at home to begin with, which also includes palliative care for some of your patients. Now, also, if you might be watching this and you might be at home already, and you might have insufficient support, you might have an unreliable team, you might not have enough funding. We are also providing level 2 and level 3 NDIS support coordination. And, we have our own NDIS support coordinator that can help you with more funding. You might be an NDIS support coordinator watching this, and you might be interested in our service for one of your participants, and you're wondering, how can you get funding for NDIS funded nursing care? Again, we can help you with that. We're also doing NDIS nursing assessments, right? So please reach out to us for that as well. And if you are in the US or in the UK and you need help, we can help you there privately. Please reach out to us as well. And finally, if you're a hospital executive watching this, we also want to hear from you because once again, we can help you eliminate your bed blocks in ICU and ED. We want to hear from you as well, and you don't even pay for it. Once again, if you need help, reach out to us at intensivecareathome.com, call us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next or what questions and insights you have. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.